I would like to start just by asking how the documentary started and why you accepted to take part in it.
It was just a coincidence that Mike Day, the filmmaker, visited a friend of mine, and we started talking. And he told me that he had made a film about the gannets up in Scotland, and he knew that in Mykines, an island in the Faroes, there was a gannet colony, and he wanted to have a closer look at the birds in the Faroes. Then we started talking about what my research was about, namely the negative impact of the oceanic pollution, which is concentrated in the pilot whales. And these pilot whales are consumed traditionally in the Faroes. And our research in the Faroes has shown, we have been doing this research for almost 35 years, that children are negatively, there's a negative impact on their central nervous system of mercury, and there's a negative impact on their immune system of the organochlorides in the fat tissue of the pilot whales. And then he started to turn his interest against this topic, and that was now I think it was around 2014 we met, and then he really became a kind of really a researcher, because in his he was acting as an anthropologist, using his camera everywhere, starting with to film my research activities. But later on, he went out into the society, interviewing people who have been participating. He was here when this killings or the slaughtering of whales took place, and he was really he was quite patient, and I think it took around 3-4 years to him to collect material for the whole film, and eventually this story developed, and he went home and edited the whole thing to the final product, which is the islands and the whales. So I think I was central in the beginning, but as the film developed, then I become more and more in the periphery. But of course, the essential message is, of course, this clash between a traditional way of living and the pollution coming from outside, making this old tradition a bit problematic, seen from a public health point of view.
Yes. So when was, if we can look at your research when you started 35 years ago, when was actually the first time that people started talking about this, like about the mercury levels in the whales and the negative effect on
it was in 1977, the first time the authorities went to the Faroese public saying that they should be a bit careful, because they have seen very high level of mercury in the inner organs, or the kidneys, liver, which was consumed at that time, and even in the muscle tissue. So the first warning was in 1977, and I started, my interest started in 1985, and when I met a colleague in Denmark, Professor Philip Granchan, who had been working with lead. Lead was used in gasoline in old days, and research showed that heavy metal could have a negative impact on the brain. So we started discussing is the mercury exposure of the Faroes perhaps was a problem as well, especially because it was known from an accident in Minamata, Japan, that children of the unborn children were more vulnerable to mercury than adults, because the mother were not affected, but their children, newborn children, they were affected. And that was a disaster in Japan. So we were planning to have a look at the newborn. We decided to make it very to really make a good study, which should take a lot of years, because we first went out and asked the mothers to join us, and then we could have a blood sample from them in the pregnancy, and we could have blood at the delivery from the umbilical cord, and then we just sat down and waited until the children were almost 7 years, and then we made a very thorough examination of their health status, with especially their brain or the central nervous system, with all kind of methods, neuropsychological and neurophysiological and classical medical pediatric methods. So, and then we concluded that we could actually, when they were 7 years of age, see a negative impact between the high exposed to mercury in mother's womb. They did a bit poorer than children with lower exposure. And that was a very important public health message. We went out to the society straight away with that after we had published it in international journals. And then our diet recommendation work actually started and have been going on ever since. And in 2008, we actually, after several other cohort studies, we have almost 2,500 children included in our studies now. Then we went out and said that the mercury, the negative effect of mercury in coming from pilot whale meat is that serious that people should not eat pilot whale meat and blubber anymore. The meat that is a container of the heavy metal mercury, and the blubber, the fat tissue, that is the place where all these organochlorine, PCB and PTE and other substances are. So in 2008, the first medical officer in the Faroes and I recommended the public of the Faroes not to eat it at all. And of course, that was really a kind of, that was an unpopular advice, because it was had been a habit in the Faroes, a part of our culture for hundreds of years. So, but of course, I was I had my priority was the health concerns, and my as a public health doctor, I had to bring forward that message that our quite extensive studies of it in the Faroes. The conclusion was, the only possible conclusion was not to eat it. Of course, they could reduce it. On the other hand, the mercury concentrations in the whale meat is that high that it should not be distributed. It would not be distributed in other European societies. So, but a lot of people said that this is a problem for our cultural identity, and of course there was a lot of organization coming from outward, as you see in the film, for example, Sea Shepherd. They wanted us to stop the whaling, not because of health concerns to humans, and more because they didn't like that at all, that that whales were hunted at all. But the Faroese, on the other hand, say, as you see in the film, that the pilot whale species is not threatened at all because they are plentiful in the North Atlantic, and they would and they did not. The Faroese do not accept an argument that a whale has a special position among the animals can be consumed. So I was a bit squeezed, I guess, between the message from outside or that we should stop hunting whales and the tradition in the Faroes. But what I have done very clearly is I don't intervene in that discussion of if it's right or wrong to kill a whale. But I must say, from a health point of view, it is not. I will not recommend people to eat the meat or the fat tissue because it is so highly polluted because of human activities around the globe, which has been part of the big oceans today, and due to this magnification process up the food chain, this toothed whale is very highly contaminated, just like killer whales, for example, which is a toothed whale as well.
Wow. Yes, it's really an incredible contribution that you're doing with your research, and I would like to go a little bit into how the population, because you were saying as well that it wasn't an easy task for you to get out with this research, and I wanted to know how people, like, where you're encountering most resistance from the people, and whether you actually have a certain percentage of the population that like wants to voluntarily help out. For example, you just said that you have a lot of children being tested, or in the films we see that you have different families that you're testing throughout time. Is that voluntarily, or like is it mandatory from the government? How does that work?
Yeah, that is a very important question, and the answer is quite easy. This is absolutely voluntary, and the very good and promising public health conclusion is actually that these mothers, if I compare a pregnant woman in 85 with the pregnant woman of today, the concentrations of these contaminants, of these toxic substances, is only a fraction of what it was now. And that is not because the concentration in the pilot whales has diminished or been, but it is only because these women have listened to the advice that they have changed their diet, and most of them are not eating pilot whale anymore. So I must say that the young woman or the coming mothers, the pregnant woman, they have been quite cooperative and have taken this message very seriously, and so that was the most important thing. If an old man are just continuing eating, I guess the harm as a consequence of that is minimal compared to the exposure of an unborn child.
Definitely, absolutely. And because of all these results that you're showing year by year, and is the general opinion changing? Do you see that changing in looking at the Faroese population as a whole, or do you feel that you're encountering more resistance?
It is both yes and it is, as I said, among the women. There is a broad accept of the message, okay, and they are sticking to the recommendations. But I think that especially among elderly men or middle-aged men, there is a resistance because of the external pressure from an environmental organization to stop hunting whales, and the men in the Faroes, in a way, they act as they want to protect our sovereignty, our right to do things our way. So, but so the health battle, it has not been won yet in the whole population, but partly there's been won among the women, and that is the important thing, especially the young women.
Yes. Okay. In the film, we see that there is a lot of men identify themselves as fishermen, as whale hunters, and not only this, but also there is a lot of teamwork involved. The community is working both on the sea, but also on land, and then everyone shares the meat together. So it seems like there's something that is binding the whole community, and something that the population and the individual also reflects on its own identity. Yeah.
No doubt about that. The role of the pilot whale hunting as a social event is very important. It has been really a part of the identity. So it was not to that extent 10, 20 years ago, but after this external wishes of changing our national habits came more and more forward, and was phrased everywhere in the international press and in the Faroes, as you saw. People from Sea Shepherd coming and telling us what to do. Then this resistance really grew, and I think now it has got a much more prominent position in our consciousness. This is a national identifier, and so. But on the other hand, that we see in the film is only a small fraction of the Faroese society. Of course, we are living of fishing and fish farming, but most of the people here are working in offices, in administration, are teachers, and in the healthcare system. But that film concentrated had its focus on the people, on the fishermen, and people living very close to the sea. But as you saw, and that's right, when the slaughtering take place, there will be a lot of people on the shore taking part in that activity. So that is really a social event, you can say it, but it's a serious one. And that's because in old days, 200 years ago, it was a poor society, and in periods there were actually lack of food. So this was seen as a blessing, and pilot whale were catched and slaughtered in this area, up in Iceland and down in Scotland, and not only in the Faroes, but nowadays it's only here in the Faroes and in the Caribbeans they hunt them, and partly in the Maori, among the Maoris in New Zealand.
Yes, I'm thinking from what you just told me that as we see, the food patterns are changing. Before it was just the whale meat, as you said, it was the main subsistence of food. But right now, we also in the film we can see that the supermarkets have food from everywhere, and also that you have tunnels to get from one island to the other, and communication through phones, and traceability of the whales through a lot of devices. So I'm wondering, while this has not necessarily distracted the culture of the Faroes, do you think that a complete cut in whale consumption would be an irreparable loss of culture for the Faroes, or?
Personally, I don't think so, I must say, and we will survive even that. And my way out of it, to do it in an honorable way, would be to use the health argument, my argument, saying it is not good to your health, to the health of the Faroese people, to consume it anymore. It was good in old days because we estimate that 90% of the mercury is anthropogenic, as human-made. So, and that was, and that started under the industrial revolution back in the 1800s. Nowadays, I think this is a very affluent society. We have people are quite well off. We have all kind of imported food in our stores, and we are producing fish, a lot of fish, salmon, and all kind of mackerel, herrings, cod. So we have really delicious seafood if we want to eat seafood, which is recommended by us in the healthcare system or in the public health system. I think that it is. My prediction is that let's say in 20 years, this habit is only almost faded away. That will be my best guess.
Okay. And do you believe that the other sources of food that you just mentioned, for example, the fishes, will continue to be healthier than the whale? Because as you explained also in the film, the whale is the end of the marine food chain. So,
yeah, when we look at, for example, cod, it's extremely low in mercury. It's only 1% of what is found in pilot whale meat. And if you look at the pelagic fish like mackerel and herring, they are low in mercury, and they are low in the persistent organic pollutant as well. But they are high in the marine fatty acids, which is beneficial to people's health. So I think we are in a very good position to recommend a marine alternative. I have many times told people in the fair, please eat fish, all kind of fish, fat fish, and just as we did in old days. I have told people many times when I was the chairman of the board of prevention, or that marine food, our especially the fat fish, are good to people's health, and I recommended them to not stopping eating the marine food and change to junk food, to pizzas and all kind of imported food. We have that good alternative. So to me, pilot whale, if they stop eating pilot whale, that is no catastrophe from a nutritional point of view, not at all. The good things found in the whales can be found in fish as well.
Okay, and
but without the contaminants.
Yes, that is definitely good news. And I would like to ask, is the whale, like these mercury levels and pollutants, does it also have an effect on the whale itself, on the whale's health and on the whale's life span? Like, how does it impact actually the marine life?
That is a very, very good and relevant question. We simply don't know. But I know there's a lot of people who have asked themselves that question. But it's a bit difficult to find out, because I can invite people to come here for examination. You can not invite a whale.
Of course, that's true.
And on the other hand, I know people have looked at some populations of killer whales and are quite concerned that the high burden of pollutant in these animals have a negative impact on their ability to reproduce and so on.
Okay, so maybe in the future we will know more if there will be some
Yeah, on the other hand, I must say that if you see these effects on humans, as we both on the brain and on the immune system, it's absolutely relevant to ask yourself: can we see the same negative effect in a sea mammal as a pilot whale? It is absolutely a possibility and almost likely.
Yes, because I believe when all these environmental and animalist movements are tackling, for example, the whaling issues in Japan or the Faroes, I wonder how much should this be also tackled to the whole world's consumption and lifestyle that have led to these pollutant levels in our oceans. How do you see this? How like what do you believe is the message to the international communities apart from to the message to the Faroese?
Yeah, that is a good question as well. I have many times told the Faroese that we could use that argument, saying uh, that we are stopping now eating this traditional food in the Faroes. And the argument is not because it's not delicious; it's because it has been polluted by all uh, these activities leading to pollutions everywhere on the globe, especially in ending up in the big ocean. And that is a very good argument to the international organization, for example, to the United Nations, as a support in the, for example, there's a new convention on mercury, the Minamata Convention, which came in force in 2017, and that work is in full swing. The story from the Faroes, or our experience in the Faroes, that anthropogenic, human-made mercury pollution actually has a very specific negative impact of our children in the Faroes. That is a very important message from us to the world, and could be a very, to my opinion, a very supportive argument to the people working with international regulation to limit the emission of mercury. And the same is the case for the POPs, the persistent organic pollutant. There we have an international cooperation on, which is organized under the Stockholm Convention. And what we are finding in the Faroes of negative impact on the immune system of our children due to POPs, that is could be a supportive argument in reducing all these emissions of dangerous substances in many places.
Yes, and maybe because we are sending a message now in this exact moment through this interview, right? We are trying to raise awareness on the issue. Maybe if you were to explain in very easy words how exactly does this brain impairment develop, and what, yeah, like for people that are uh, don't study these themselves, how could we understand the impact?
How we could put it in a simple wording. Yes, when a child before birth is in full swing developing its brain, when it's exposed to mercury in mother's womb, then this process will not go so smoothly as it would be without mercury. And that we can see in the Faroes when we test them thoroughly, neuropsychologically and physiologically and all kind of tests, that the high exposed, the children who are exposed to the most mercury in mother's womb, they have, when we compare them with the low exposed, there's a difference. They are doing not as well as the children who are not so exposed. And the good thing in the Faroes, we have a very broad exposure range. Some mothers have not eaten pilot whale at all, and others have consumed it a lot. So we can compare the low exposed with the high exposed, and that is on the brain. the mercury has the main effect that is on the brain. But if you take the other exposure, as we call the POPs, the persistent organic pollutants, then it's not the brain which is the main target. It's actually the immune system, because we can see that these children, they do not react as well as they should on the vaccination, the child vaccination. The child vaccination we have used that as an indicator of how active their immune system is. We vaccinate when they are small, and if you measure the antibodies to these vaccinations, you can see that the high exposed to PCB and to the fluorinated compounds, the high exposed, they produce antibodies to much less extent than the low exposed, indicating that the immune system is affected as well. And that is an important thing, because we are very dependent on our well-functioning immune system. So that has, so to me, even if the effects are small in, for example, regarding intelligence, it's not a big thing. On the other hand, if I can see the effect in a whole population, then it is a big thing from a public health point of view, because these negative impacts, they can be removed. I mean, these children most of them are quite smart, but they will be even smarter if they were not exposed to this extra load when they were in mother's womb. That is a point. That it's a bit abstract, that you could do even better if you are not exposed to mercury, and your immune system could be perhaps more efficient if your mother had not eaten these food items which are so high in contaminants.
And what would you then think that would be your wish of the impact of this documentary?
My intention when I started this work as a young doctor at that time, 35 years ago, was actually to find out if this habit had any negative impact on the Faroese. And I must admit that when we started, I was convinced that it was not harmful to us in the Faroes, maybe because this was a part of our way of living, and so far everything has been quite successful in the Faroes with creating the society. On the other hand, when we made up the results and concluded when they were 7 years of age, we came to another conclusion, and that we had a negative effect. And that effect, we had to communicate that to the scientific community in the whole world by publishing in scientific journals, and we did so. And of course, I could stop there and saying I did my duty by reporting this to the scientific community. But I felt as a local doctor, I came to the Faroes in a permanent position in '88, that it was my duty to communicate it first and foremost to all the participants, all the mothers and children who have participated in the project, of course. But secondly, to the whole population here. But on the other hand, this project, this research work has been generously funded by international organizations, public organizations, the National Institute of Health, the EU, and the Danish Ministry of Environment and Faroese research grants. We have got a lot of them. We also had there was an international perspective, of course, because international funding will not come just as a Faroes for Faroese sake. It was because our research was relevant to all the societies. because there's lots of societies out around the globe which are highly exposed. So the second reason to do this after the local was actually the international. I wanted, and my colleague Philip Grandjean wanted, to make a contribution to the knowledge what mercury is doing with people. And that is important to me to have that message communicated. And now you are giving me the opportunity to tell a very much broader audience than the Faroese that the oceans have been polluted with many substances, among them mercury and a lot of persistent organic pollutants. And that is due to that we have, as humans, been irresponsible. And I hope that we can use this as a lesson. Not only our project, but I think this is a very clear showcase that if we just pollute, one day will come when you have to take the responsibility, for example, by making the conclusion this is harming our children, as we have seen in the Faroes.
I hope the message will be received by a very broad audience. And to end, I wanted to ask you about the family that we see during the film and the different subjects. How are their attitudes towards the issue continuing? And also, to begin with this one.
I don't know. I think that was a very charming family, I must say. It was a pleasure to communicate with them. But as you saw in the film, the mother was a bit concerned. She was a nurse, and the father was less concerned. I think that is a fair reflection of the general status in the Faroe society, that the women are more concerned and acting accordingly, and the men are more traditionalist, saying what was good in old days must still be good. So, but I don't know if they have changed their habits today, but I guess if any change has happened, then it's I think they have reduced their intake.
Okay, that's good to know. Thank you. And the last question is, how about the Huldufolk? What is? Could you explain your relation to the Huldufolks?
I have no relation to the Huldufolk. I was a bit surprised when Mike Day, the filmmaker, started introducing Huldufolk in the film. I think I saw the whole thing were quite scientific, and this is a quite metaphysical concept he introduced there. On the other hand, it's true. It has been a part of the Faroese folklore that Huldufolk were out there in the darkness, living up in the hills. But I must say, from an artistic point of view, it was a good meta story that there's a consciousness out there looking at what we are doing wrong.